And the Biden administration has announced that it is letting the COVID-19 public health emergency expire on May 11th.
This marks the most public signal yet that federal officials believe the worst of the pandemic is over. According to Johns Hopkins, there have been more than 14,000 COVID-19 related deaths in the U.S. in the past month. That's down significantly from 2 years ago. Of course, in January 2021, the U.S. reached a record high of nearly 100,000 deaths.
Joining us now is Dr. William Schaffner. He is a professor of infectious diseases for the Vanderbilt University Medical Center. Dr. Schaffner, thank you for being here. We have spoken with you throughout this pandemic. It does seem appropriate to ask you now what the end of the public health emergency entails, specifically in terms of benefits Americans have been receiving and a look towards what we've always been wondering, which is whether this has now become endemic.
Well, ladies, it's good to be with you. And as we look forward to this resolution of COVID, it's both ambitious and optimistic. As we transfer to the old normal, obviously, if you have medical insurance, that will cover many things. But for example, it's unlikely that the vaccine will continue to be freely available to everyone. And so we're concerned that as we go back to the old normal, we will have the old normal of disparities much more evident. And this is particularly concerning since COVID disproportionately hits those segments of the population that have the most difficulty accessing good medical care and preventive health services.
Really important.
I'm curious about your expert opinion. What's your take on the announcement? Is it that the emergency is over and sure, we should move on and move forward? Or could the federal government be jumping the gun?
Well, you know, we in infectious diseases are taking it a week at a time. And so here we are at the end of January predicting what the COVID circumstances will be in May. That's rather courageous. You know, let's be sobering about this. The last time we did that, that was about a year and a half ago. And then along came Delta. And that upset that apple cart for sure.
Yeah, tell us for Americans who are easing back into, I'm going to say normal life, though it doesn't feel like life is normal anymore. What's your recommendation to prevent the spread of COVID-19 as well as try and minimize the chances of trying to, I guess,
get any other
get other diseases or
other
colds that seem to be just spreading like wildfire, at least around here?
Well, two clear recommendations. One, please take advantage of this new bivalent COVID booster that's out there and widely available and continues to be free. We have under-accepted that booster, and it's clearly keeping us out of the hospital. The data are secure about that. That's number one. Number two, if you're in a high-risk group, you're more likely to get severe disease and be hospitalized. If you're older, if you have an underlying illness of heart disease, lung disease, diabetes, if you're pregnant, if you're immune compromised, those people particularly ought to be careful. Keep using that mask. If you're traveling, yes, use the mask. Going to the supermarket, use the mask. Still observe some social distancing. This COVID virus is out there. It's going to remain with us, and we're going to have to keep our guard up.
And if you're sick, stay home. Dr. William Schaffner, thank you so much.
Thank you.